topic, and I'm here with a Dr. Zach, veterinarian, and we're going to talk about common question we get, which is when to take your dog or your pet to the emergency vet. We're going to talk about some possible home remedies for common things that Dr. Zach sees as an emergency vet. He'll work at the emergency department quite frequently, and talk about, when is it maybe okay to consider waiting until your regular vet's open, and when you should just like rush right away to the vet. So with that said, welcome, Dr. Zach. I'm excited to have you here.
Yeah, absolutely. This is a good one. Like you said, this is something I think you and I hear all the time, or at least a weekly basis. So I think it's important because you just never know as a pet parent at home, like what's the threshold for, like, can I try something, or is this something I shouldn't waste any time? So I think it's a really difficult situation for sure for any pet parent to know kind of like when something's going wrong, what exactly, where do I make the choice that I just need to go, kind of thing. So
Absolutely. And, one big disclaimer, Dr. Zach and I were talking about this before, is that we are sharing this we're not trying to treat, prescribe, diagnose, cure, or even recommend. And we're not in any time saying that you shouldn't go to a veterinarian. But I think where there's a big gap happening, and this is a totally different topic that we'll maybe talk about another time, is there's definitely becoming a time very near where there's going to be, and it's already happening, but a veterinarian shortage. And I'm getting comments all the time, and I know, Dr. Zach, you see this a lot, where pet parents have issues that they aren't sure if they're emergent, but they're not able to get a vet appointment. So it's like, okay, what can I do in the meantime? So we're sharing this just as kind of how we would handle it with our own personal pets, our friends' pets, families' pets. So that's our disclaimer. Always consult your local vet for any health or medical issues. So let's jump into it. A couple of the topics we're going to talk about, and then make sure if you're watching live or even on replay to leave comments and questions, and we'll do our best to get to those. But a couple things we're going to talk about, just so you know what to expect, is vomiting, diarrhea, panting, foxtails, first aid kit that you should have with you at all times if you're out and out with your dog. But the first one I want to talk about is one of the more common ones, and that's if my dog is getting what I think to be a hot spot or a rash or dry, itchy skin. Dr. Zach, I know you have a lot of specialty experience with this. At what point do we need to get our dog into the emergency vet for that, or can we try home remedies?
Yeah, for sure. So I'm glad you started with the skin one. That's good.
Mm-hmm.
So, I guess when it comes to skin stuff, and if there's something that looks like it's starting to kind of accelerate, right, in an area, the good news is that with skin, it's probably the one thing that we often can address at home first. And so that's super important on, not to say that there's not some skin things. I've seen, some dogs, unfortunately, that have like really big tumors that start to bleed and they can't get them stopped at home. So that's not what we're talking about here. We're talking more about like the hot spot or the really itchy site that maybe starts to have a little bit of bleeding or looks really red or inflamed. That's kind of what we're talking about here. And so, when it comes to these things, the first part is to stop on like acceleration of the symptoms that they're having, and then the second, obviously, would be to try to start to remediate it or to neutralize it at least in some way. So, the first thing, which is the one that we literally get the most pushback as vets, I'd say, in this topic, but is the most important, is getting some type of physical barrier to prevent from the licking or scratching at that site. Because both of those are going to continue to break the epidermal barrier, which is obviously a really strong barrier we have. It protects us every day from the environment. But licking is continuously adding oral bacteria to a site, and scratching also is going to break the skin, as well as going to add more bacteria from under the nails. So that's the most important thing. So it's always something I always recommend, because most animals have it if they've ever been spayed or neutered, like they have a cone or a e-collar that they have at home. It's important to put on in times like this to stop the cycle first. Or if it's something that's lower or they're not looking at it but they're scratching, then you can get things like full body suits, or like even like some people have thunder jackets that can cover most of the body and stuff like that. So that's the best thing. The first step is to essentially stop the cycle of accelerating the negative direction. So so after that, what we can do is kind of assess how bad has the damage been. And in most situations, I would say that this isn't something you have to rush to the vet right away in most situations. But there are a lot of at-home remedies. Many of them, we included Naked Pet because we couldn't really find a lot of them in a concentrated or collected form. But the first thing that if we are worried about there being a hotspot, hotspots are whether they were a primary cause from an allergic disease that then compounded into an infection or it's an isolated infection. Hotspots, the real name for it is pyotraumatic dermatitis, which means that it's a bacterial traumatic infection of the skin, if you break that phrase down. So infection is there, so we need to address infection. So, my favorite thing to do at home would be to have a proven, tested silver hydrosol product would be something to have that's good. Have at home some betadine, which is a very benign natural antiseptic that we use sometimes before like surgeries. We can use it. So those are two antiseptics or antimicrobials you can have at home. Obviously the silver one is the one we have, and then the betadine you can get probably at almost any pharmacy. The only thing wrong with that one is it's kind of brown, so it stains, but it will help with reducing the bacterial load tremendously, as will obviously the silver hydrosol, which silver hydrosol is a clear substance. So that would be the first step that I would take. It's kind of trying to get rid of that bacterial load at that site. And then the second would be to help with calming irritation or inflammation that's going on there. So topically, there's several remedies. Again, we have Naked Pet created some of them through our itch relief spray, which is good. Also, our skin rejuvenator has antioxidants and aloe vera in it. So there's a lot of things you can look for topically on that side. So when you're looking to obviously promote anti-inflammation, which I feel like is what we talk about a lot anyway in holistic medicine. And then the second would be, there are some oral remedies that can help with pain related to inflammation as well. So, obviously CBD would be one I like. PEA, which is something that we talk about much. Something actually Judy Morgan talks about sometimes, and I really love that molecule as well. So it's kind of like an endocannabinoid-like molecule. And then there's various others. But the bottom line is that, when we do have a hotspot or a site that looks like it's really getting red or inflamed, step one is to help to slow down or stop the cycle of decline. And then second would be to address the infection and inflammation that's there. So that'd be something that I think you could do at home pretty successfully. And then, if it still looks like it's getting worse or it's not really responding to that over about a 2 to 3 day period, then I would probably schedule an appointment with your regular veterinarian.
Yeah, I think for, from kind of the pet parent standpoint, it's always tough. I'm definitely the one that, and this Dr. Zach, if my dog, looks slightly off, I'm like, I need to run to the vet. But I've also, been in situations in my life where vet appointments weren't as accessible because it's not inexpensive, right? So I understand there's a lot of people that I see it in the Facebook groups all the time, and I get DMs of, oh, my dog has this little like rash or hot spot, and do I need to rush to the vet? So my default is always, yeah, if you can get to the vet, great. But if you can't, what Dr. Zach said has worked wonders for me. We had my senior lab Bentley, which I need to share this, but he had, I still don't know exactly what it was, but a little bit of a rash in his groin area. We think it might have been like a type of fly bites. And it was one of those, like for me, what I did was I used the silver hydrosol, which is from Naked Pet, which is all linked down below. So those are the vegan, human grade, vet formulated by Dr. Zach skin care products, both shampoo and conditioner that you can use kind of as regular bathing, but then also more topical treatment options. And it felt like it was overnight. I saw immediate improvement. So having resources like that are more natural and holistic, but also effective, was really nice. And then another thing is just sometimes I worry that some of the skin stuff I see is a result from some of the products we use in our home. And we've talked about this a lot, but just one thing to just be conscious of is, laundry detergent and the scents in those, or wall plugins, or Febreze spray, or the soaps and lotions we use on us, there can be a lot of skin irritants on those. In fact, most of them have it, even the ones that claim to be pet safe. So if you're having reoccurring issues, one thing to consider, in my opinion, is like look at the environment in your home. Like, do you have a lot of scent filled items? Because those are highly irritating to both dogs and cats.
Yeah, especially when you see, kind of recurrent, mild to moderate redness or irritation on like the belly, on the ventral abdomen, or even like in like the armpits. That's a lot of times something where I'm wondering if there's something going on in the house that's a substance, or a cleaning product on the floor that was used that maybe dried up, but it could, the residue is still there that the dogs are laying on, that can kind of cause the skin to be irritated for sure. So
And would you say the same thing, Dr. Zach, for somebody mentioned like a like paw pad sometimes? I mean, I had that with Marlo, you remember, but
yeah.
she had like a cut on her paw pad and she was limping a little bit. And again, I used the silver hydrosol. And I think I also used the skin rejuvenator as well with that. I think I switched between those two from Naked Pet. Uh, and I just kept her activity low. But are those ones that you suggest to rush to the emergency vet, or to maybe some home remedy stuff for those?
Yeah, so it kind of depends, I guess, again, on the severity of it. But
Yeah.
in a situation where the bleeding's pretty minor, and the first, well, basically the first step in any of the situation would be to try to apply a light pressure to it. And if the bleeding can stop after some light pressure, then or it stops spontaneously on its own, then I would say yes, it has an opportunity to respond well at home to an at-home remedy trial for sure. And the two you mentioned are perfect because the silver hydrosol is an antimicrobial, like we just discussed, and then the skin rejuvenator has 3 or 4 ingredients in it that are going to help with both healing as well as reduce inflammation, and then help the skin cells essentially heal, grow and heal themselves. So yeah, that'd be something to try.
Okay. And then that's really helpful. And then I know that you do for skin issues is like that could be a 3-hour long live. So
Yeah.
I know that I know that's one of your specialties, and I know you have online telehealth appointments available. I know that you're kind of booked out a little bit, but if you're watching this as a pet parent and you really want to get your pet's allergies or skin health improved or gut health, I know Dr. Zach is a really great resource that you can schedule an appointment for, and I'll have it all linked in the description below for you. So for the next one, I know that working in emergency vet med, I asked you like, what are some of the most common things you see? And I think one of the first things you said was diarrhea, vomiting. So can we talk a little bit about, what do we do? I've actually struggled with that with my dog on and off, where seemingly out of nowhere, my dog will have diarrhea. And I'm like,
Mhm.
okay, do I need to rush him to the vet? Do I try some home remedy stuff? So what are your kind of thoughts on that?
Yeah, for sure. So as an emergency doctor, the main thing I actually look at, which is funny because it's like not in the book, but the main thing that I assess when a pet parent comes in with an animal that has, vomiting and or diarrhea, is the energy of the animal. So the
Mm.
patient and the behavior of the animal, and kind of like what's their energy at, which sounds weird, but it's kind of like, for me as a doctor, the trigger for whether this is something that we could treat. It's just kind of an empirical remedy for a couple of days, see how we do. If we don't do well, then come back. Or is it something that we need to start with some diagnostics right away, like some blood work and some x-rays and maybe even more stuff? So the energy of the animal is kind of the first thing that I look at, which is obviously something you could look at home. um, and so if an animal is, so the clinical symptoms of having vomiting and or diarrhea, you know comes in a scale, just like with the skin stuff. So if your pet is still very bright and is alert and is running around and is playing, and had a vomiting episode, we don't really know why, or had some loose stools, and I'm like, I didn't really change anything, I don't know why this is happening right now, like I don't remember him or her eating anything that was abnormal. But the animal is still like very energetic and is looking to play, is interacting with you, then, to me at least, if that animal was with me in the emergency room, I would have a discussion about how I think we could try some supportive care at home with a diet modification and maybe some probiotics. So that would be what I would do if you came in the clinic, and that's what you could potentially do at home. So obviously the first thing in that is a diet modification. So, what I usually do short term is kind of increase the fiber content. Well, no, first we'll fast for about 18 hours, 12 hours for vomiting, 18 to 24 for diarrhea. And that's of course an animal that's able to fast. If you're diabetic, then I wouldn't recommend that. But for the majority of animals, we would fast. We'd rest the gut because we don't want to reduce the secretions that the gut is making, and that helps to reduce the inflammation as well. So and allow for healing. So we would fast for let's say 12 to 18 hours for vomiting and 18 to 24 for diarrhea. And then after that, we would do like an easily digestible diet. So my classic is a lean protein ratio 1-to-1 with some steamed high fiber veggies, because veggies are going to be pre and postbiotic in and of themselves for good bacteria. That could be really anything. Broccoli, cauliflower, zucchini, squash, pumpkin, sweet potato. Anything really works. And then I usually recommend to try to get some organic, low sodium bone broth, or a veterinary formulated bone broth if you can, fast enough. And that's usually what I do every time. And then I guess this would be the situation also where I would consider maybe some probiotics if it was some diarrhea. Maybe about 14 to 21 days. Yeah, and that that's the same conversation I would have with you if you came into the vet's office or you didn't. And again, that's based on the energy of the animal.
Right. And so one thing I didn't hear you say was to feed my dog rice. A lot of times if you Google, what do I do if my dog has diarrhea, or you go to a conventional veterinarian, they're going to say, oh, okay, well, they probably won't. I don't know if they'll mention fasting, which I agree with 100%. I always fast for 24 hours if my dogs have diarrhea. But one thing you're going to see a lot of and hear is that you should feed a bland diet, and they'll usually say like cooked chicken, cooked lean ground beef with rice. So why didn't you mention rice?
Yeah. So the rice thing never
Calling
made
you
sense to me.
out.
Before I even started looking into integrative holistic medicine, I never understood the rice thing, because I feel like rice, the rice that we eat, right? We're not eating rice like it grows in nature. So we talk about starches all the time as like these really bad things, which obviously the starches are, unfortunately, they're mostly processed, or only the digestible components of it. But rice, any starch in nature has basically been made with a high fiber component and a low fiber component. And so rice is no different. Like, it has a hull, and we remove the hull, and the part we eat that's rice is just the starchy inner digestible component. So the reason why that's not great is because it's a simpler starch, and it's easily digested by bad bacteria, sometimes better than good bacteria. And so it's not going to really help with controlling the gut. It's potentially going to be pro-inflammatory in more than one way, and it may support the colonies of bacteria that we're not looking to support in that situation. So it's not really something that has any benefit in that situation. Not that like an organic brown rice, I guess a little bit of that in a diet, a whole food diet, is not terrible. I wouldn't say that like I would X out a diet because it has rice in it, but it's not really my favorite ingredient ever, honestly. But especially in that situation, it doesn't make sense physiologically to add a simple starch in that situation. It's not going to be really that high in fiber either. So I'd rather go with something that's going to have both a high content of soluble and insoluble fiber, which both have various benefits when you are trying to heal your gut, in combination with a lean protein and especially some bone broth, which is useful in a lot of ways.
Yeah, I'm glad you explained that, and you explained it well, especially something I even forget to mention when I talk about this, that the the simple starches in the rice can feed the bad bacteria even more, and especially when our dog is in such an inflammatory state, as you mentioned. Why would we give them more pro-inflammatory foods, especially when biologically they're not really designed to digest large quantities of simple starches like that? So
Yeah.
it's becoming more mainstream knowledge to not feed rice as part of an everyday diet for a dog, especially when they're ill. But I still see it. So
Yeah. And again, and in this topic, there's a long list of other potential holistic remedies that exist. So Upper GI, we talk about adding some slippery elm after you've done your fasting. Lower GI, we have a couple like marshmallow root, which is a classic herb that we talk about a lot, which you can get at a natural holistic store near you. There's usually like several, like even Whole Foods I think carries one. I've never looked at their sourcing, so I don't know 100% where they get it from, but
Yeah.
that's a good one to consider. And then there's a couple of products out there which have a combination of ingredients. I know Dr. Harvey's has one, and Animal Essentials has one. So those would be good things to potentially have on hand at home. If your animal does experience 1 or 2 episodes of upset stomach. So there's some things you do. Now, on the other scale of that, though, like I said, the energy of the animal is very different. So we're kind of lethargic, or we're very reserved, or we're not interacting with the family anymore, or we're kind of just sitting in a corner or laying down in our bed for 8 to 12 hours, and that's definitely not like our pet. Then that would be something where I would say, maybe there's something else going on. There's different levels of upset stomach to the more severe ones that we see where they do start developing blood in either the front or the back end. So I honestly use that as kind of like my trigger, whether I'm kind of addressing an at-home situation or I'm in the emergency room. So I would recommend that as kind of like for pet parents as well, because it usually is pretty accurate in my opinion.
Yeah. We have a question here. Where can we find Dr. Zach in New York? Scout Inquiry. So he actually offers, he's a little booked up, but there are still appointments available for his one-on-one, like what we're doing right here, vet telehealth services. So that's all linked below for you. It's actually pretty incredible to be able to, and we're so thankful that you're offering this to our community, Dr. Zach, because being able to access veterinarians one-on-one like this is becoming harder and harder. So anybody looking for more personalized help, that would definitely be the option for you. And then a couple of the things on diarrhea, because I've been struggling with this on and off with Finnegan, my dog, that I learned. One from Dr. Judy Morgan said this, and it resonated with me as an over worried dog mom at all things, is she said, sometimes dogs have loose stool or might be a tiny bit constipated. And she said, she's a veterinarian, and she was saying that, uh, if her dog is a little bit loose stool today and then fine tomorrow, like for her, she doesn't really worry about it. And, obviously if this is chronic and it happens all the time, getting it checked out is important, but that kind of gave me some comfort, because just like humans, sometimes, food might not interact with them perfectly well. And it's okay to not have perfect stool every single time, I think is what she was trying to say. And then another veterinarian told me once that with these episodes of diarrhea, let's say your dog got into something they're not supposed to, or stress can cause that. Like if you travel and your dog is anxious about that, diarrhea can, I think you mentioned this, Dr. Zach, but diarrhea can last like 7 to 14 days, meaning that it might take a while. So I think sometimes for me, for example, I took my dog in after he had diarrhea for 5 days, and I was panicking. I was like, my dog's dying. Like and the vet's like, look, like his vitals are fine. He has energy. He's good. He's, and that was, I didn't even put 2 and 2 together that they were kind of looking at energy, like you mentioned. And she's like, you sometimes just have to let it run its course, right? Like we did testing and he was fine. And that just kind of resonated with me as well. Sometimes this stuff takes a while and to resolve itself, and that's okay. At least that's what I've learned from veterinarians.
Yeah, for sure. And like we just said, we discussed a few at-home remedies you can look into. And yeah, but it is something that diarrhea does take some time. Like there's for it. I have a couple of products that I like that can sometimes help with that. Like one product that actually I recommend over telehealth a lot because it's super available online, even through like Chewy, which Chewy doesn't carry, in my opinion, the best products. But there's a product called Diagel, which is literally just a collection of herbs that I only have a couple of emergency rooms I work with that use this product, and I love it because it's literally the only real product I know that stops diarrhea really quickly. There's some some veterinarians will recommend Coptis, which is another herb that can be used sometimes, which I've heard also can almost be like Nature's metronidazole, but I haven't worked with it honestly that much. I like Diagel as like a product that's really great. There's a couple other, it's like a paste essentially that you essentially give for once or twice a day for 2 to 3 days, right when the diarrhea starts. Um, and even if your animal has a history of like getting stress colitis, which is what we call
That's right.
when they're stressed, you could even start that product like a day before you're going on a trip, or you're leaving for a trip and they're staying home, where they sometimes get that condition. So that would be something that, again, I trust that it's readily available in both conventional and holistic sourcing online. So that would be a good rescue thing to have at home. I would actually say, because it is a good product.
That's a good idea. And then the last thing I'll say on that, I love that you mentioned like a pet safe bone broth. So like obviously no onion in it and no added salt because of the electrolytes in there. Oh, it's one thing I learned with my dog is he would sometimes his energy would be a little off, but everything else tested normal when he first episode of diarrhea he had. And after giving him, we did a little bit of raw goat milk and then some bone broth, and he perked right up. And I think one of the things that was happening is he just fell off, like his electrolytes were off because he was having loose stool. So I like that you mentioned that as well, and I think that's really valuable.
Yeah.
Okay, so for the next one, okay, so on the opposite scale, what if my dog is constipated and they're not going to the bathroom or even vomiting? I know those are two different things, but how do we look at that as a over worried pet parent?
Yeah. So the vomiting side, again, is similar. It's there's not too much you could do at home for that except for fasting. And again, fasting is extremely significant. And when I say fasting, just so everyone knows, fasting doesn't mean like you don't get water. So I would not withhold water like this entire period of time, like the 12 to 18 hours. A couple hours, yes, like right after the vomiting, I would withhold it for like maybe 2 hours at most, because when you do vomit, you almost like want to drink again. So a little bit just so they can clear their throat, but I wouldn't give them a whole bowl right after that. So I would fast them. Honestly, like I said, that's really the best thing that I see successfully with vomiting at home. The problem is that there are some things that are recommended on the holistics. There's some homeopathic remedies. It's called Nux vomica, which is a homeopathic. It's like if you ever go to store or online, you can see like these little tablets, which there's lots of different homeopathic remedies. The problem that I see with that a lot of times is that these animals are vomiting and they can't keep anything down. So how do you give oral supplements to an animal when you can't keep anything down? That to me it's always been a difficult balance. I've tried to recommend it a couple of times to some pet parents that were really like proactive and were like, no, I can handle this situation, I think. So I was like, all right, cool, that's great. Like then these are the things I know about. Do I see it work on a consistent basis? And the feedback is 50-50. So with vomiting, like I said, it's the energy component becomes even more important. So when we're fasting them or letting them rest, it's okay to let them rest. I'm not saying like if they're resting and trying to recover, that's not a sign of like down energy. It's more like if you go them up and they're very lethargic, or they're down, or they're reserved and they're not really responding to anything, or they're kind of just sitting in one spot or in the corner. Those are the changes I'm seeing. But vomiting is something that there's not too much to do at home in the short term other than really fast them. Now, if they vomited, in the middle of the night, have withheld food over the course of like the day into like the mid-afternoon, then that's something where, I do think we can do some stuff. Again, we kind of mentioned most of them already, where we would kind of feed. I'd recommend changing the portion size a little bit to like a little bit versus, like their normal size volume, but I still would stick to the same kind of, home mentioned where, a novel lean protein, you could ground turkey, lean ground beef if they tolerate beef, scrambled egg, or even like whitefish is not a bad thing. Those are all proteins that are very lean that can be given in this situation, with a little bit of some steamed high fiber veggies. Remember, with fiber veggies, you have to steam them. You have to lightly cook them to make them more bioavailable. But yeah, that's where I'd start. And the bone broth is great too, because it not only does have electrolytes, but it has protein, fats, and carbs in it. So and collagen, which is obviously a great thing for our gut. It's good for our bones, good for our gut. So I literally stick to the same kind of short-term diet in that situation. And then the slippery elm would be useful in that sense as well, because that helps with gastritis and stuff like that.
Yeah. And, obviously, if you think your dog has eaten something that they shouldn't, maybe like a sock or rocks or something. My one dog likes to pick up rocks. It makes me
Yeah.
nervous. That I think that's always a tough one. It's like maybe they'll pass it, maybe they won't, but I know that might cause vomiting sometimes. So, we all just kind of have to make the best decision based on what we know for our pets. I know I have my mom's dog that she likes to put moisture in his food a little bit, but she learned the hard way that if she puts too much, I think because his tummy's smaller, he'll like vomit it up. So she knows now just to put a little bit of moisture, and she feeds him a little bit more frequently, because we notice if he eats too much volume of food, it just irps it up. Just
Yeah.
like
Yeah. For sure.
so.
Yeah.
So that's stuff that's kind of helped. And then on the constipation side, I know that. So what are your thoughts on this? I was reading a post. I don't remember who wrote this, that dogs should be having a bowel movement daily. Is that pretty recommended standard, would you say?
Well, I guess it kind of depends on the diet they're getting fed, to be honest. I
True.
would say usually, dogs usually do have like a daily bowel movement, I guess, for sure. And if they're on a kibble diet, that could be up to twice,
Multiple.
sometimes
Yeah.
3 times a day. Even if your food diet that has, a good amount, has a good amount of veggies in it, which, I'm not really opposed to veggies if they're kind of like the high fiber type. So, even if, whole food, lightly cooked or raw, not really, I don't have a preference on that too much. But those dogs would probably defecate a little more. But if you're feeding a really high protein and fat, minimal carb diet, that's on the carnivore side almost, then I would actually not say that they would defecate every day on a continuous basis, because of the fact that the amount of organic material that they're eating, a lot of it is going to be digestible for sure, and so you're not going to have the same bulk volume that's coming in that's going to be coming out. Yeah. With that said, our stools are actually, the majority of it is actually bacteria, with the indigestible parts. So if you're taking away a lot of the indigestible parts, then, the higher portion of that stool is actually going to be even more bacteria. So, so I would say in an animal that's eating almost like an obligate carnivore type diet, where it's predominantly fats and proteins, they may not defecate every day, and their stools are going to be much smaller in volume. So they're going to be like almost like little nuggets, versus being like what we usually
Mounds.
see. Exactly.
Loose mounds.
Yeah,
Yeah.
exactly. So, but yeah, I guess that kind of depends on
Dog.
the dog and the diet. And I think that also dogs have different patterns, same as humans. Humans have their own bowel patterns. Not going into too much detail. So
I know this is turning into a poop episode. I love it. No, but then for constipation, one thing that blew my mind learning years ago is that like plain pure pumpkin can both help with diarrhea in some dogs, but it can also help with constipation. Like my Finnegan, it actually will make him go potty, have a
right.
bowel movement. Versus my other two dogs, it actually bulks up their stool, which I think is interesting. What are some other things we could do if our dog's having constipation and we want to avoid going to the vet, but maybe like a home remedy?
Right. Well, on the first part of that, what constitutes as constipation? So constipation for me would be something where we haven't defecated. Well, I guess it depends on the dog, but I would say that in general, if we do assume that a dog defecates once daily, that that if we waited maybe like at least 3 times longer than that. So if a dog poops daily, then it's been 3 days. If it's a dog that poops every other day, then maybe 5 days of not pooping is where we would get concerned that we're constipated. So I guess it really depends on the dog and on that first side. And so that would be the first thing. The second, if we do think we're constipated, the best thing you can possibly do is increase the water content of the diet. So you can give both regular water as well as things that are, very high in water content. So whether that is, offering them just, a bowl of, again, instead of water, like if they really like the bone broth, then give them bone broth multiple times throughout the day in addition to their water. There's, several veggies that are high in water. So like melons, safe for dogs, and you can give them, most types of melons. There's cucumbers, which are high in water. So tomatoes, there's this, don't want to give too many tomatoes. It's actually back for that one, but tomatoes are safe if they're cooked, not if they're raw. So, but anyway, long story short, there's
A
a
lot
lot
of
of,
options.
yeah, let's take that one back if you cook your tomatoes. But anyway,
Yeah.
but the, food side and supplement side,
Yeah.
that's where I would start. I would increase the water content in their diet as much as you can. The second would be soluble fiber, like you said. So actually what we talked about before a little bit, there's insoluble and soluble fiber. It's just kind of like a chemical differentiation, but soluble fiber, which is
There's my mom's dog. Here we go.
someone's at the door. So increasing the soluble fiber content. So pumpkin is a great example of that. Is something we can do for sure. So and that's why it kind of works a lot of times to help with defecating if we need it.
Yeah.
A third thing would be there's several supplements that have like psyllium in it, and so that's a common thing we see that you can give to try to help ease constipation. Just trying to think.
Movement, a little bit of exercise, I think,
Yeah,
for
a
humans
little bit
too, like
extra.
kind of that, yeah, that
Yeah,
movement.
I don't know. It's really hard. I don't think I've really ever thought about like at home remedies and for that. But it's fun. One thing that is so just I guess on the other side of it, so there's a lot of like laxatives that exist for humans, right? And one of them we actually do use in pets sometimes short term. This is not forever, but short term. Miralax, which is actually used in cats a lot that have chronic constipation, and
Really?
that's a benign substance, so it's not really something I would consider a harmful over the counter human medication. And you can give it a couple of times if you'd like to try and help with that, because that's like an asthmatic um, constipation remedy versus a couple of the other ones, which like I don't like the ones that like promote promotility or anything like that. This can be a little bit dangerous. So, but that would be an at-home human thing that you can try, which is actually pretty safe. But
Yeah, and Mama Bear in the comments makes a good point for those that are feeding a raw diet, that if bone content is high, like the raw bone, we never feed cooked bone, but if the bone content is high in a raw food diet, or if you're feeding raw meaty bones, like a raw chicken wing or raw chicken neck, that can bulk up the stool, and that's actually one thing that helps my raw fed dog when he has diarrhea is I'll just give them a little bit more raw bone and it helps bulk it up. So that's another on the bulking side.
yeah,
It might be too much bone.
yeah,
So I want to talk about some things of like, okay, we need to rush to the vet now. A couple of the topics and what to look for. A couple of the topics being like bloat or seizures. But there's a couple, since this theme of this is emergencies, some things that are top of mind for me is kind of friendly reminders. And thank you, Toby. Appreciate it. Mama Bear also says slippery elm can help. That is true. But a couple things to remember for almost like preventing emergencies. One is, so I'm in the Pacific Northwest where we get a month or two of wildfires near us. So, but house fires can happen anytime. So make sure, as like a preventative thing, that you have one of those stickers on your house that a firefighter or a policeman can see that says, "Hey, I have two dogs and a cat in my house," or something like that. I think that's one of those little things that can kind of help keep your dog kind of out of an emergency in the case of an emergency. Another thing is, this is actually kind of extra. I forgot I had this in my last house. They have these little, like, how they have in-home like nanny cams for pets, where they actually have them now where it's not a camera, but it's a little device and it will actually tell you the temperature in that room. And the reason this is important, this is a really sad story, so I'm not going to go into great detail, but my mom's friend of a friend, they live in the South in like the deep of summer, and they work 12-hour shifts. And that in itself, I think, is kind of too long to be leaving your dog alone. But unfortunately, the AC broke on an extremely hot day. And unfortunately, the dog got too hot and passed away. So that's really tragic, but that's just one of those things that like kind of monitoring the temperature because the person, he didn't know that the AC was broken. And then another thing to watch for are foxtails or these like grass seeds that can get stuck in. This is actually really common,
Mhm.
especially in like, I don't know, East Coast if these are common, but West Coast in the summer.
Yeah, we don't get these that much over.
Oh my god. It's like in all the groups that I'm in and I get DMs all the time like, "Oh, like how do I take care of this foxtail?" And once it gets lodged in, it gets in their ears, their
Yeah,
gums, their eyes, their paws. You got to go to the vet, and it's, I mean, it's painful for everyone involved. So like giving your dog booties if you're going to go out hiking, or just honestly, I avoid going out. I mean, in the summer it's usually too hot anyways, but I avoid areas that have a lot of that,
mm,
and regular body checks too to get those off. Because in our last house, like they would just go potty, come right back in, and they would have like three kind of stuck to them, and then they would fall off my dog and then burrow into the carpet. So you just have to be really careful. So just make sure you pay attention to those. And
oh,
last thing I'll say is I'm a big advocate of pet insurance, especially for emergencies, because it's not inexpensive to deal with pretty much any emergency at the emergency vet, just because it's, usually a lot of really high, a lot of care that goes into having to take care of an animal in emergency. So pet insurance I always recommend. So anyways, that's kind of my little like soapbox of things to watch out for.
now I just I guess touch on the last one, and then there were a
Yeah.
couple of things that were in the chat that I was going to touch base on. But
Oh
yeah,
yeah.
there's not. I can't honestly tell you the last shift I've ever worked where I didn't um, say the average emergency bill just for diagnostics, because obviously I start with diagnostics alone. When you see me as emergency doctor, we start with diagnostics first, and then we talk about treatment, because I guess I don't know what's going on yet. So diagnostics alone, the first estimate that I give you, um, 8 out of 10 times, maybe more, is going to be over $1,000, and that's just the first half. So pet insurance, starting early with that, is super important. I can't even tell you how much it eases the minds of the veterinarians, but the pet owners as well. When they come in, they're like, "Oh, don't worry about it. I have pet insurance." the 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 cost for the monthlies for that is definitely going to make sense in the 9 out of 10, maybe more situations. So it's just important today for that reason, because like I said, I working emergency when I'm in the clinic. There's not a time that there's not a day that I have to not, that I don't give several $1,000 estimate easily. It's not a day that I have to have a conversation with an owner about just the financials, unfortunately, because that comes into obviously into relevance when we're talking about that. So definitely would touch on that. And then just a couple things in the chat. Someone mentioned about pumpkin. I think you already answered the pumpkin one, right? That pumpkin
Hmm.
should. There was one about whitefish that was mentioned. So yeah, whitefish is something that's just a general term. So it could really be any type of fish that's pale in color. So the one I like the best is cod. That's an easy.
Yeah.
The floor fish, like the tile fish kind of fish, like halibut, is not terrible. It's a pretty good whitefish. Tilapia I kind of stay away with because it's just so heavily farmed. But if you can get like wild trout, that's not a bad one as well. So there was a mention on what whitefish is, because I actually didn't really know what that was. I've seen it in diets formulated, like kibble diets. It was like whitefish and potato, and I was like, I don't know what a whitefish is, but I wouldn't feed that long term. Obviously, seafood there's some has toxin buildups that if we were doing that every day, I wouldn't do that. But when it comes to like a very novel benign protein to give in like a diet for a few days, I do think it's actually a great option for sure.
Agreed. And one, I actually forgot a really important topic, and Scout Inquirer mentioned it. First aid. So, and then we'll talk about seizure bloat because I think those are a little bit quicker topics, anyways. But one thing you mentioned to me before, Dr. Zach, was like if you're going to go on a hike, or even if you're just taking your dog out and about,
Yeah.
having a first aid kit with you can be really beneficial. What are some of the things that you would have in your first aid kit?
Yeah. So just to, as I mentioned as well, there's actually a bunch of resources online for like different first aid kits that you can kind of mix and match what you like the best out of all of them. To tell you the truth. So and some of them will go into different ideas or details about like what you should include. But there's a lot of resources for that. But you know, and the reason I say that is because there's like first aid kits for different, like you can have an at home first aid kit for
True.
that'll have like eye wash in it or ear cleaner in it or kind of the stuff we mentioned, like some diarrheal, anti-diarrheal remedies you can do. And then, but for the kit, like if you're going outside and you're going into your car, like that kit's going to be a little bit different. So, at least in my opinion. So, for going outside, mostly I would say it's like kind of like physical trauma stuff is what I would carry with me. So, first would be some gauze pads, like some wound pads, some bandage wrapping material. Those are important. I would definitely have like a couple pair of like those rubber gloves, just in case there is blood that you have to deal with. Kind of fluids. We don't know what they're from. That nature. Something you can get at the store. It's like the styptic powder. It's called like when we use when like if a nail gets broken, that can help with short-term bleeding sometimes. A lot of times they'll recommend like putting flour in a wound, but I don't think I would recommend that. That styptic powder is used for that specifically. So I think it's called, so one of the brand names is like Quick Stop is one that you
Mhm.
can have. A couple other things, I would definitely have some like tweezers with me, like the ones that have like the very fine point. If you do need to get something like if a foxtail gets buried in, you need to do your best short term, or if there is something that's small and sticking in your pet, or even if there's like you see a tick and it's attached already,
Mm.
use those to get off. That would be something. Um, Bandage materials and bandage scissors would be good. We already mentioned the materials. Bandage scissors or something. They're like a certain type of scissor we use in the clinic all the time that has like a blunt end that if you do your pet gets caught in something, if there's a wire on the ground or you know I could think of a variety of reasons, but that would be something good to have on there. It's just like a blunt end scissor. That's we call bandage scissors. Um,
One
that
other
was
thing,
yeah.
I just saw somebody post about this and I didn't even think of it, but like if you hike with your dog, especially if they're bigger, they make these I think the brand is Rough Wear. I've never tried it, but it's like a harness that you can
Oh
put your
yes,
dog in. You
yeah.
have one?
I've heard of that. I've heard of
Yeah,
that. Sure,
and
yeah.
it's almost like a pseudo baby carrier for a dog, not to carry in leisurely, but like if your dog hurts themselves and they can't walk and you need to hike back down, you like strap them in, and it even comes with a muzzle. Just because sometimes when dogs get hurt, they can get scared and react a little
Oh
bit.
yeah,
So it
for
keeps both of you safe, and then you strap them in, and then you can hike back down. That I think for hikers
sure.
would be
That's
really beneficial. Yeah.
yeah. Yeah, and just to name that topic, it doesn't have to be a black box topic. Like pets bite their owners all the time when they're in pain. Like it's just that's a thing.
Oh, okay. Yeah.
They're not doing it because they hate you. They're like,
No, they're
that
just
really hurts, and like, don't do that. So
yeah.
most
Oh,
times it's a warning bite, but they do bite. I see pet parents get bit all the time by their pets.
oh
So
gosh.
so
Does
having
that
some,
happen a lot as especially in emergency vet? Like do you or are they usually kind of just so out of it?
no, yeah, that's when I see that. I see them. I see the owners come in. They're like, oh, he got me, or oh, he got me too. Can you help me out?
You're like, okay.
I can't, so, but yeah, I mean, even dogs hurt themselves all the time. Like, dogs are running around, they're playing, they trip, they fall, they have a broken bone, like they have a fracture, they have a luxation, they have a sprain, a strain, like these things hurt. So, if you pick them up and you don't know where they hurt yet, they're gonna be like, that hurts right there, and then that's just their only defense is their mouth. Cats were, it's a blessing and a curse. They have claws and a mouth, so you got to watch out for both. So,
I know.
but
My cat
yeah,
my cat has gotten me wanted to get on antibiotics. It was right in my joint. She bit me when
oh yeah,
that was years
yeah.
ago, but yeah.
So it's just a common thing. Like it's not a muzzle is not like a terrible thing. Obviously you don't want them living in it, but
Yeah,
I think it's a black box topic.
I
I hear
know.
all the time. So it's not something that you have to be like, oh, I'm the meanest pet parent ever. Put my
No, well, and here on I won't go into the topic much, but I learned from another veterinarian, and I don't think a lot of pet parents know this, that a lot, I won't say all, but a lot of veterinarians when they take your pet to the back, a lot of times they will muzzle, or the vet techs will muzzle your pet just for overall safety. They did it with
Yeah.
Marlowe. And they told me ahead of time. They were like, okay, so just so you know, we're going to take her back. We're going to muzzle her, and then I think give her the sedative before she got spayed. And I
Yeah.
was like, what? And then they're like, yeah, this is actually common practice. And so it actually inspired me. I now want to muzzle train all my dogs because they're not muzzle trained, just so they're comfortable with it because
Yeah.
they get it anyways. Do you see that a lot?
No, I think that's actually a pretty good thing to consider. I might actually start including that in like my puppy telehealth is to
Mm,
muzzle. Very interesting. Actually. I mean, what I always put myself in the dog's position, right? I'm like,
yeah.
I'm hurt or I'm feeling really crummy, and now I'm in this building that smells like other animals that I don't know who they are. Remember, because they can smell 25,000 times more than we can, and they can hear sounds in another room where animals are probably already, and they're probably, especially first time, they've got to be, scared on the majority of situations. And then you have these people that you never met before that are touching you and trying to stab you with things, and
Yeah.
they're trying to put you on a table, a cold table, and it's got to be scary, for sure. So, outside of like the fear-free, approach from the vet side, because obviously that's our responsibility is to,
Sure.
go slow and do our best to kind of acclimate an animal as much as they can. Um, that's our responsibility to do that for sure. So I'm not saying that that vets should skip that step because I think it's super important, and if you watch me as a vet, like there's cues that you need to pick up on. You need to give an animal time. You need to let them make the first move if they're willing to do it. These are things that we should be doing on our side. But at the same time, an animal that comes in, they've never been there before. There's all these smells, there's these sounds, there's these sights, there's these random people that are pulling my leg. And so it's a safety measure for a lot of times for the team that during a procedure or having to draw blood or even place an IV catheter, a lot of animals we do want to do that because it's going to be a quicker and experience, number one, for the animal, and a safer experience for everyone involved. So yeah, so it's something that I feel like, again, like I feel like it's a stigmatized topic,
Mm.
that it's like, muzzling your dog means that they're an aggressive dog and that they're a bad dog, and it's really not that. It's just it's to hasten a situation that is stressful to get the end result, in my opinion, and it's just one of many tools. But again, like I said, like there's a lot of things that go into that interaction, and the vet side, they veterinarians and vet nurses need to realize that this animal is an emotional creature as well, so you need to understand that, and every dog's different.
Yeah. Oh, well, very well said. Okay. I know we're getting close on time, but I do want to address bloat and seizures. And I know that for these are common ones that people worry about, possibly experience, and hear about. And obviously, these are things that we want to take to a vet if we think our dog has bloat or if they're having seizures, of course. But I guess my question for this is, what are some things to look out for? Maybe ask the vet when we take them in, especially for bloat from your experience.
Yeah, so bloat is a specific thing. It's like this. It's a very feared word or phrase, I would say, because it is something that we don't see very often, honestly, but it is what I would consider probably one of the two life-threatening, truly life-threatening in the moment situations when an animal is vomiting multiple times and seems really uncomfortable. So the important thing to know with bloat, or what's called a GDV, which I actually had one the other night. I don't know if you saw my social, but I did surgery on one at like 4 in the morning, and
Oh, I missed that. I
dog.
think I'll have to look
Oh
that
yeah,
up.
yeah. So
Oh
I don't know if
no.
it's on there anymore. It was on my story, but I
Oh, okay.
night. And these animals, the first thing to know is that going back to the energy thing, these dogs are in severe discomfort. Like you can tell right away that they are completely effaced from interaction with people around them, and not just their abdomen that's kind of distended a little bit. They're going to have a lot of changes. So the things we see is that they'll try to be vomiting, but nothing will come up. They'll be very hypersalivating. Um, Sometimes their gums will turn either white or they may even turn a little blue, because of what's happening inside of their abdomen. And then a lot of times you'll see kind of like the distended abdomen. And this is a disease we talk about a lot in large breed dogs, but there are some deep chested dogs that are smaller as well that we do see this sometimes happen. So specifically like the bully breeds, even down to like English bulldogs can get this as well. So, um, so for that situation, there's definitely nothing at home you can do. Like the amount of things you have to do in the emergency room, it's to help with that situation are very elaborate. And so if you are ever worried about that, about your animal being bloated, it looks like they're vomiting and nothing's coming up, and they vomited multiple times, that's a situation where you need to get to an emergency hospital as soon as possible. Hopefully you have one near you. Obviously, as we talked about earlier, that vet care is becoming a little bit harder to find, especially in like rural areas. But if at all possible, in your emergency kit, I would have every number and address to the closest top 2 or 3 emergency rooms that are in your general vicinity or area, which is going to be crucial to have. So you got to get them there as soon as possible, because time is of the essence when you have that situation maybe happening. And again, it's not that common. Like, we don't see it very often. It's not like every large breed dog gets a GDD. It's not about that. But something that's concerned about happening, there's no better time for a safe approach, for sure.
Yeah. It's interesting that is such a feared, commonly talked about topic when it's not super common, but it's, I think, to your point, because it's one of those things that if they have it and you wait, the fatality rate, I believe and understand, is pretty high, especially if you wait, and that's really
It's
scary.
100%. Yeah, it's 100%. Yeah.
Yeah. So that's why it's it's feared. So it's good to be aware. And I wonder, I do you see a lot of people coming in and saying, "Oh, I think my dog has bloat," and then they don't? Is that kind of pretty common?
Yeah, sometimes they'll say that it looks like their dog's belly is kind of distended more than usual, and it could be a variety of anything. Like, you can,
Yeah.
sometimes they'll have a food bloat, which basically means that they went to the dog Chinese buffet and just ate everything possible, and their stomach can be very distended from that. And
I've never had that problem.
so we've seen dogs that their stomach will be their actual stomach, like the organ that's the stomach, that's an expandable sac, right? It'll take up like 3/4 of their whole body. Sometimes they can eat that much and the stomach can expand. So but there's different types of bloat, is basically what I'm getting at. And so the bloat that is the life-threatening one is a GDV. So versus like you can have an air bloat or a gas bloat, or a standard bloat that we're talking about here, or they're just vomiting because they have another thing going on, anywhere from inflammatory gastroenteritis, which is upset stomach, to an object that's obstructing their GI tract. So wide range of things that exist.
Yeah. And then lastly, seizures. So this is something I've dealt with personally with my cat, not any of my dogs, knock on wood, and thankfully. And it's one of those things that's like really scary, and one of those things that I know is sometimes idiopathic and difficult to necessarily diagnose, sometimes becomes management. And I know this could be a whole different topic, but this was one that was asked about when we posted about this episode. So what are some high level thoughts around, okay, my dog had a seizure, we take him to the vet, right? But what are some other things to look for when it comes to that?
Yeah. So again, seizures, like you said, can be caused by a bunch of things, a large variety of things. Like down here in Florida, for example, we have cane toads, which are more known as bufo toads. And if a dog bites one of those toads, they'll have a seizure. If they bite it, enough, they'll have a seizure within a couple of minutes, right? But then, like you said, there's idiopathic epilepsy, which is another cause, and then there's having a stroke, which is another cause. So the seizure, and I love neurology because that was actually what I initially was going to do as a vet. So I love talking about neurologic stuff. So, but the seizure is, in and of itself, is actually just in an analogy, your brain kind of sneezing. So, when you have a tickle in your nose, you sneeze, right? When your brain has some type of tickle, it has a seizure. That's just how it works. It's just the expression of that organ. So something's causing the front part to be excited, and we don't know why. Well, sometimes we do if we've already done the workup, but if it's a first time seizure, we don't know why. And that's kind of the workup we would do at the bedside, is kind of work up for the things that are outside the brain or extracranial, and then things that are inside the brain, which are intracranial, which is what a neurologist would do. But in the event that your animal has a seizure, or what we think is a seizure, because again, there's also things that look like seizures that aren't. So if we're ever concerned they had a seizure, though, the best thing to do at home is to, number one, try to get them away from anywhere or anything that they can hurt themselves with, right? So, not around stairs or any furniture that could fall on them, trying to get them as far away as you can, but at the same time, staying away from their mouth, because if there's one way that pet parents get injured is when they're trying to put their hands inside the pet's mouth or near the animal's mouth. So we want to just keep them away from as many things as potentially could hurt and stay away from their mouth, which is where you could get hurt. Okay. In that situation, if they do have a seizure, what you want to also do is start a clock in your brain, or literally a physical clock, because if an animal has a seizure that lasts more than 3 minutes, that's considered a medical emergency, and I would not wait for the seizure to stop to get them to the emergency room. If an animal has a seizure that lasted maybe 30 seconds to a minute, which is much more common, then what you can do at home is kind of get them stable again, kind of allow them to recover from it. Give them a few minutes to catch their breath and to maybe sit up, which they'll eventually kind of regain their consciousness, and they'll kind of sit up. You can kind of wipe their mouth off if they had some saliva, if they did urinate and defecate on themselves, which is also common. You can kind of clean them up, and then I would go to the vet. But if the seizure is lasting more than 3 minutes, I wouldn't wait. And obviously, it's super scary. Totally get it. Like, seizures are never fun. Whether a human or an animal, they're just kind of terrifying in the way that they look. So, but if
Yes.
you have to start that clock, because if it's been 3 minutes or more, then you can't wait for them to break out of it and go. You have to get there as soon as you can.
Interesting. And should we ever reach our hands in their mouth to try to grab their tongue?
So, in animals, I don't think I've ever seen an animal choke on their tongue when they're having a seizure. They may bite their tongue, but I personally have never seen that happen. And when I was being trained at my neurology practice, that was never something we'd ever recommend doing, because that's a foolproof way for anyone to get injured.
Yeah. Interesting. Yes, seizures are very scary. I've never seen one in a dog in person. I think my cat, it was really tough, but hers were very quick, and she kind of gets up and then she's kind of just sleepy. But she's small, right? She's like 7 pounds, but I couldn't imagine a huge, like 60-pound dog. That's got to be terrifying.
Yeah. Now, one thing you can have at home, I wouldn't recommend it for a first-time seizure, but two situations. Number one, if we have an animal that isn't epileptic and it's been properly diagnosed, obviously it's important to get a diagnosis with seizures, for sure, because the predominance of possible causes varies drastically by both breed and by age. So again, that's why seizures, to me, it's just a symptom. It doesn't really tell you what's the cause at all, because there's a list of dozens of things that can cause it. But if you have an animal that's kind of been worked up, I guess, and they've done at least a workup for outside the brain things like low electrolytes, high electrolytes, changes to blood glucose, liver kidney causes, Cushing's disease, low thyroid disease, etc. All those things have kind of been at least worked up for and ruled out. And, it's relatively younger dogs, so less than 7 years of age, where epilepsy is possible. Then one thing you can do is you can have a full spectrum CBD extract at home, which would be something to potentially try and maybe even practice, but it wouldn't require you going into their mouth. It would only require you lifting their lip, and you can kind of just dribble a little bit on their gum line. I think that can be a home remedy. Again, I know it almost like contraindicates what I just said, but I'm not saying like go in their mouth and put it down their throat and into their GI tract. The goal would be to get it on their gum line, where it gets absorbed right into the bloodstream. Obviously, the whole talk about CBD, so the product that you're using is obviously super important, and we've kind of went into that in the past a little bit. But that would be probably, in my opinion, the only potential at-home remedy you could do to help stop a seizure. Not that that doesn't mean you should see the vet afterwards, but that you could maybe stop a seizure at home would be to have a quality, proven, full spectrum CBD extract that you could just dribble a little bit on their gums if they're having a seizure, or even after the seizure to help slow down the potential of having.
Yeah. And I think you made me think of one other really important step is I know in the midst of it, it'd be kind of chaotic, but try to make note if you've recently given your dog flea and tick preventative, heartworm medicine, or have given them vaccines. And that's something to let the veterinarian know and make sure is reported, or like those Seresto collars, because there is a neurological impact of giving those products, even though some of them are important, like, our core vaccines, for example. But that's important to make sure is reported and shared, because there can be a link between the two.
Mm-hmm. Yeah. I was thinking we were talking the other day, you and me, about one that I
Yeah.
was confident we saw in the emergency room, but the problem was it wasn't my case to like take care of. But there was like this 7-month-old or 8-month-old little German Shepherd puppy that had seizures within 24 hours of both their flea and tick and it was a weird situation because it's hard to be like 100% this is what's causing it, but the correlation was just, it seemed way too coincidental for it not to be an accurate situation, especially in such a young dog. You don't really see young dogs like that get the number of dogs having, unless it has a really bad congenital disease. But it would be weird for there to be a 1 month apart and within 24 hours of the flea and tick products that were being applied. So, and the one that they were giving was Simparica. So it's in the isozazoline group, which is with NexGard and Credelio. So
Yeah. That's tough.
Yeah.
Oh, okay. We are at time, and I think we covered the hot ones. This was fantastic, Dr. Zach. And for those of you watching, again, if you want a personalized online telehealth vet appointment with like one-on-one with Dr. Zach and team, that'll be linked in the description below. I know he's booked out a couple weeks or so, but it's
Lots open.
yeah, there's some slots open, and it can even be more just general checkup. I see some comments in here. There's some questions in here we didn't get to that if you just want a second opinion, for example, on something your dog or even cat is struggling with, then you can schedule that. It's something that I'm really grateful to offer in this community. And then I know we mentioned before, and I get questions asked about this a lot, about what shampoos, flea and tick preventatives, and things that I use, which is Naked Pet, and that's all linked in the description below. My other ask is to please, subscribe and share this video with friends and family, because what we're trying to do is make vet care and vet support more accessible. And that's all thanks to Dr. Zach. So thank you again for being here.
Absolutely. Yep. No, these are fun. I like doing this because, I feel like I get these questions anyway when I'm in the emergency room. So I'd rather talk about it before you get there, so that you can kind of feel at least educated at home and confident in making decisions as a pet parent, because we're a team in this situation. So it's the vets and the pet parents need to be working together to make these animals' lives beautiful. So
yes, and big shout out to Mama Bear and Scout and Camp Goer. That's kind of cute. And April, Suzanne. There was another one in here that earlier, Umbor. And there was one more, Chiara. Thank you all for being here. There's a bunch of you. Appreciate your support. And with that, I hope you guys have a beautiful day. We'll see you